Good afternoon. Welcome everyone to the second meeting on the Senate Committee on Health and Human Services for the 83rd legislative session. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus. No. Ready. And Chair Doniate.
And I'm here, and please mark Senator Titus excused. Great. Well, welcome everyone to today's meeting for Senate Health and Human Services. Today's going to be a pretty short meeting. My goal is to get it done within the hour, so let's see how successful we are. We have two bills slated to be heard today, SB 8 and SB 137. So just as a quick recap, I do have a few housekeeping announcements. Please note that the agenda items may be taken in a different order than listed, and two or more agenda items may be combined for consideration today. For those who wish to testify, we ask that folks please sign in at the table by the door and provide a business card to our committee secretary. And if you do not wish to testify, you may also want to sign in so that there's a record of who you are. When testifying, please turn on your microphones on to speak and off to listen. And we have listeners both and viewers in Las Vegas and online and are recording this meeting as it will be available on the legislature's website later. As in past, any person proposing an amendment to a bill being heard by the committee must submit the proposed amendment in writing. And then we ask that public comments may be kept for 2 minutes so that everyone interested in speaking can be accommodated and we can get through the agenda today in a timely fashion. And then last but not least, I just ask for folks to please turn off their electronic devices so we can put them on silent during the meeting. Let's go ahead and start with Senate Bill 8. So I'm going to go ahead and open the hearing on this bill. This bill revises provisions relating to services provided by the Aging and Disability Services Division of the Department of Health and Human Services. And we have Administrator Schmidt back with us here in Senate HHS, so please begin when you're ready.
Thank you very much. Dina Schmidt for the record. I'm hoping this will be the quickest bill today. SB 8 is really just a cleanup bill. All we're doing is amending the language in 427A.123 with similar language that we had updated in previous sessions in 435. So the position for attorney for the rights of older persons and persons with a physical disability, an intellectual disability, or developmental disability is the new language. So everywhere in this section of the bill where we previously had related conditions, we're just changing that to developmental disability. And that really was at the request of our advocates a couple sessions back, and we just didn't get to this particular chapter, and that's really the gist of the bill. Nothing changes as far as the services or the duties of the position. And so if there's any questions, I'm happy to take those.
Thank you. Committee members, any questions? Senator Lang.
Thank you. I just have a quick question. In reading the bill, I noticed that in most places you say intellectual disability, developmental disability, but in some places you only mention a couple. And I'm just wondering if you didn't want to be consistent in having physical disability, intellectual disability, and developmental disability listed in every section. And you know more about it than I do, so I just am looking for an answer about why that didn't happen.
Dina Schmidt for the record. So the title of the position includes all of those disabilities, and then in the section that has definitions, we are just referring to the definition of a developmental disability used to be defined in this section. We're now just doing a reference to section 2 NRS 435, so that we only have one definition of a developmental disability, and so that we're not repeating it into several. So if we make any changes in the future, we don't have to go update different sections. And so throughout the bill, the only time you'll see all of those is when you're talking about the actual title of the position, if that helps.
Thank you so much. Just as a quick follow-up to that, can you give us like an example of why this cleanup language was necessary, or like what is a situation that prompted you to have this? Maybe if there's a real life example that could help us understand just a little bit better.
Dina Schmidt for the record. So I am not a physician or a clinician, so I hope I don't get this wrong, but my understanding is a few years back, the advocacy groups had requested, we've moved to person-centered language, and the term developmental disability more clearly defines the particular types of disabilities and issues that an individual may have, and those are defined in 435.007. Having the term related conditions was unclear what those related conditions were, so this just provides a very clear definition of the exact things that fall under a developmental disability. And if you'd like me to read that and kind of give you some examples, a developmental disability can include, let me find it here real quick. Autism, cerebral palsy, epilepsy, fetal alcohol spectrum disorder, or other neurological conditions diagnosed by a qualified professional that is manifested before the age of 22 years old, is likely to continue indefinitely and results in substantial functional limitations as measured by a qualified professional in 3 or more of the following areas of major life activities: taking care of oneself, understanding and using language, learning, mobility, self-direction, and capacity for independent living.
Thank you so much. Any other further questions? Senator Stone?
Thank you for the brief presentation. Seems pretty simple. How does the change from related condition to the new definition align with the existing Nevada revised statutes, and what impact will it have on service delivery, if you think it has any at all?
Dina Schmidt for the record. So we're really actually aligning with the definition that we already existed in 435.007, and there will be no impact to any services. And in this section, we're just aligning that definition of the position, what we call an advocacy attorney, but the legal title is Attorney for the Rights of Older Persons or Persons with a Physical Disability or Intellectual Disability or a Developmental Disability. So that is the title, and we're just correcting that title to include developmental disability.
Wonderful. Thank you.
Thank you so much. Any other questions? Seeing none, let's go ahead and move on with the testimony. So if you would like to go ahead and testify in support of this bill, please come forward now, either in Carson City or Las Vegas. BPS, is there anyone that would like to testify in support for this bill?
I'd like to testify in support on SB 8. Please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. Next, we'll go to anyone in opposition here in Carson City or in Las Vegas. AVH, is there anyone on the lines?
If you'd like to testify in opposition on SB 8, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And last but not least, is there anyone in Carson City or Las Vegas for neutral testimony? Please come forward. AVH, is there anyone over the lines?
If you'd like to testify in neutral on SB 8, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chair. This is Dora Martinez, and I'm actually I was calling in to support, and I didn't know that my hand did not raise. May I please go on?
Please proceed.
Okay, I'll be quick. So this is Dora Martinez, like I said, with the Nevada Disability Action Coalition. This is actually one of our bills that we advocated for 81st session, and I just want to thank one of you guys' colleagues, Senator Robin Titus, who also sponsored HAR 1 to clean up the wording for the Constitution, taking away dumb, blind for deaf and hard of hearing, and visually impaired. So thank you so much for everything that you all do. Take care and stay warm. Stop it.
Chair, there are no more callers for support on SB 8 at this time.
Thank you so much. Are there any closing remarks? Seeing none, we'll go ahead and close the hearing for this bill. and move on to the next one. So I'll go ahead and open the bill hearing for Senate Bill 137. This bill requires the establishment of a program relating to medical emergencies, and I believe our presenter is in Las Vegas, so please begin when you're ready.
Good afternoon, everyone. My name is Soraya Woods, and I am presenting Bill SB 137. This initiative aims to increase survival rates for cardiac events by creating a coordinated system of community responders. The goal is to establish Nevada as a leader in community-based emergency response by increasing the number of CPR certified individuals in Nevada and improving access to AEDs through key measures that include signage in public buildings, training opportunities, and increased emergency preparedness efforts. Some of the key components are signage in public and government buildings, utilization of government facilities for training, mandatory training for government employees, community engagement and support, digital resources and outreach, and rural area initiatives. And I am open for any questions.
Thank you. Senator Neal, did you want to provide any comments or anything? Sounds good. Committee members, do we have any questions on the bill language? We'll give them time. Senator Stone.
Thank you, Mr. Chairman. What will be the way that we're going to recruit and train volunteers for this new program?
Ms. Woods.
Soraya Woods for the record. The intent is to have signage that encourages the community to sign up to get training. So that would look like signage in libraries, signage in government buildings. That's where we would start. In addition to that, I would like to see inclusion on government websites, so city and county websites maybe have a dedicated page on their current sites that talks about heart-related issues and that encourages the population at large to get trained in CPR.
And I would also just make quick note that in section, 3A, lines 27 through 44, set out who could be the potential partners, public and private.
Thank you very much.
Senator Titus.
Thank you, Chair. I think this is yours.
Thank you, Chair. So I apologize, number one, for my tardiness, and I'll try not to let that happen, at least too often. So I'm curious about the list of people that I think it's not a bad idea. I think the more people you have educated in CPR, recognizing cardiac distress, the better. The quicker to treatment, that we know the quicker time to resuscitation saves lives. And so all of it's good. And we know that the access to healthcare in general is not very good in our state. So anytime we can raise that bar, I'm all about access. But I'm also about communication and realistic expectations. So I'm wondering, with your list of potential people that can help with this, have you, because the American Heart Association, incredible programs already, have they been at the table and engaged and are prepared? And do they have an idea how they could help you? I'm just curious about how do we actually get this done? It sounds great, but how do we actually, I want to see results, and as you do. And so I was just curious.
Senator Neal for the record, and then I'll have Ms. Woods add in. So we did have a conversation with the American Heart Association. They currently have a cardiac emergency response plan, and they were saying that how this Heart Safe Communities fits into that plan. They also have a Smart Heart Coalition that they felt like if this was to pass, that Smart Heart Coalition could also be a really good partner with moving and developing the Heart Safe Communities.
Yeah, for me, if we're, again, it's all about, are we going to make change, real change for everybody? So thank you.
Thank you, Senator. Just more of a logistical question. Are volunteers, so it's my understanding that the bill's trying to make sure that folks are equipped with the resources in case of a medical emergency occurs so that they are, the right standards are built in place. More of a logistical question. I know that sometimes uh, we face this in our health facilities where a patient may faint, right? But obviously, we have medical professionals that are trained with the right resources to actually respond to it, and other folks try to intervene. So, are volunteers also going to be equipped with the resources to, maybe stand off in case of once a medical professional takes in, or how to transition it? So,
That's a very good question. I'm going to have her add in Ms. Woods, but Senator Neal, for the record, I asked that same question, right? So when she came to me with this idea, I was just like, we have to talk about real reality, right? How does this work when it's implemented? What are the real plans and how this works? So she was like, baby steps. So when you get folks trained, right, you have as many people as possible who are trained in CPR, so that you know that in her vision, in the division of the plan and the partnership, is that you have a designated person that you know exists, because in her big goal, right, big picture, that you would see that there's a heart safe community sign or signage where you know that there are people in that community who have actually received that training. But I want her to distill a little bit more information, because she had this really big global picture, and I was like, you had to make it bite-sized, right? We pass law, we pass policy in order to ultimately put your big goal into law, but the steps in order for you to implement it start at that partnership level. Who's going to do what? How are you going to do that? How do these grants, gifts, and other things work together in order for you to build to your ultimate goal? And so, Ms. Woods, if you would like to add in, like, what do you feel like your first step and second and third step before you get to your big picture community?
Soraya Woods for the record. Thank you, Senator Neal. That was actually a great summation. So basically, you're correct. The big picture is that I want to be able to work with, and not me specifically, but I want to be able to work with communities around the valley to engage in becoming a heart safe community, so that there is maybe a directory or some sort of app, and this is all future planning, so that people can press a button or whatever that looks like to know that there's somebody in their area, or to activate people in their area to respond, because those critical moments before EMS shows up are very important. However, in the interim, in the baby steps, we're just looking at getting people trained, and perhaps, again, the websites will help, because everybody has access to those websites. So if we can create some sort of page on city and state websites that we can have who is volunteering, who is trained, who the local trainers are, so that there is a community that can start from somewhere. So that's my goal, is just to have some signage and some representation digitally, so that we can have like a central location to start. Even if it's something that I need to start, if it's a separate website, but I would love to see city and state back this, so that we can, and county back this, so that we can have it on their websites as well, so more people have access.
Senator Neal, for the record, one thing I would really want to bring up, just to kind of close the loop. So when 988 was being developed, right, for suicide prevention, they were having a lot of partnership meetings early on, right? So it was OMH, churches, and they were really bringing in stakeholders after they had decided they were going to create 988. And so this is literally would be that process. So you would have to gather, right? And then you bring all your partners together, and then they help to develop the plan within an existing plan, right? We no need to reinvent the wheel when we know a cardiac emergency response plan already exists. No need to invent the wheel when we know Smart Heart Coalition already exists. We also know that 211 exists, which is now what we should be using, right, as our global space for information. It's now where we go for food, resources, and other things. And I think that this just adds to where you're like, okay, I am in need of CPR training, and I think the natural alignment would be to put that in 211, but that grassroots effort that I know that I saw that was happening with 988 on suicide was, I see that as one of the ways in which this would roll out, because I remember being at the church meetings and then them talking about it and educating the community and helping them understand, number one, what are the heart, in that case, what are the suicide prevention? And in this case, it would be like, what are the heart risks? Why does CPR matter? Why should you know about it? Why should you know who knows CPR? And who are then the reference partners that you can go to for if an incident occurs?
Thank you, Senator. Senator Lang and then Senator Titus.
Thank you. Senator, I'm just curious, are you going to start small and then get larger? And what communities might you start with?
Senator Neal, for the record, definitely small, baby steps. I will be a person like a wings for Miss Wood, but I'm assuming that she will, the coalition that she's going to create, they have to decide. I mean, clearly you should work within the communities where you have the highest amount of risk, right? Heart disease crosses all races, but there are still other communities who are faced with more impact. I think that the cardiac emergency response plan should also be used as a guidepost of what's inside that plan to know, like, all right, well, this is what American Heart Association has already targeted. Don't reinvent, but build on top of, and then move forward within those communities so there is always alignment.
Thank you, Senator Titus.
Thank you, Mr. Chair, and I thank you for allowing more questions as this is going on. I appreciate what you're trying to do, but when Ms. Wood talked about communities, I'm wondering, and you mentioned it, and along what Senator Lang asked the question, exactly what communities are you targeting, and how will you identify them, and for that, from what I'm hearing, it's really the Las Vegas Valley, those type of things, but this would be a statewide program, and wondering about reaching out rural areas, tribal communities, because again, it's not just, if you've done studies on heart disease, and as you said, it it doesn't recognize income, racial background, your religious affiliation, we all have one, even though sometimes people don't think we do. We all have one, and all of us can be affected by heart disease. And so what I'm reading and hearing from the testimony is really focusing on your known communities within perhaps the Las Vegas Valley. And I'm just wondering about, tribal liaisons and reaching them. And finally, I don't see on here churches and schools. And I think that those were huge. I mean, my granddaughters already know CPR in their school. And I'm wondering as a resource, have you reached out to the school or church communities to get this? Again, education's key.
So, Ms. Woods, would you like to add in? I know as Senator Neal, for the record, I know what she told me. She does want it to be statewide, and in her mind, right, she sees herself getting in her vehicle and driving up north and, walking around with Heart Safe community pamphlets and saying, here I am, get involved. But clearly, right, at the grassroots level, it's a little bit deeper than that. So, Ms. Woods, if you would like to add how you plan on making this statewide. And really, it's going to start with your collaborations and your strongest partners who are going to help you reach that statewide goal, because they're already statewide and some national.
Absolutely, Soraya Woods for the record. So yes, that's exactly what I plan to do. So I live in Las Vegas Valley, right? So of course, that's where I personally would start. However, in developing relationships with American Heart Association, for instance, who is a very large entity all over the globe, as a matter of fact, I am looking to pull on them to help reach all of those areas that you specifically mentioned. So the rural areas, the tribal areas, Northern Nevada, everywhere that we can get to, we're actually looking, and they have a program already in place, like Senator Neal said, to begin the foundation upon. And so a big part of their program reaches out to schools. And so we definitely are inclusive of the schools. That probably will be where we start, churches next, and we'll just continue to build. We'll just pyramid, and continue to grow until we reach as many people as possible.
And Senator Neal, for the record, we can definitely add to Section 3A because they have in line 40, sub 7, community health organizations, and they also have established one or more advisory committees, which then that is not catch-all language, but we could add like some catch-all language that then would allow for the churches and then tribes. I mean, because technically in line 2, they mention federal, state, and local government agencies, but that does miss the tribal communities, which have to be explicitly listed. And so I do appreciate those comments, and that would be something where we would just have to add to section, that section in lines 27 through 44.
And follow up, if I might. So, thank you, Senator Neal, and thank you, Ms. Wood. And I understand your passion. Folks that know me know I'm passionate about healthcare, making sure people have access to it. But what happens, Ms. Wood, if you are no longer able to you are passionate, you're dedicated, and I appreciate you doing this. But what happens what's the succession plan to make sure it's sustainable if you personally are no longer able to carry the banner?
So,
Absolutely great question. Oh.
I'll just quickly answer that, because actually in the bill, I think I just lost a section. It did discuss any successor programs. So there was some contemplation that there would be other successor programs that may be affiliated within the public-private partnership. Maybe that should be spelled out a little bit more, but there was, I believe it's on, it's line 35 where it says, or any successor program. And so it can't live and die with her, because you have to have the ability to move forward. And it does allow for some language within the partnership that it also moves within other successors that may be affiliated within that same subject matter.
May I also add, Soraya Woods, for the record? So that's the goal in creating the coalition and creating advisory committees, because my vision is to have persons on the advisory committee beside myself here in Las Vegas, Nevada, but also in the rural communities and in like Reno and Carson City. So we want to have people all over that are a part of this committee. I don't want it to live and die with me. Yes, I'm very passionate. I just want people to survive. Like, that's really my whole goal, right? We have too many people who don't survive cardiac related deaths or cardiac related events. So I just really want people to survive. And I'm starting this, but I don't know where this may go, right? I just want this to be the start of it, and I want people to get involved, and I want for if I'm no longer available, somebody else is going to run with the banner.
Thank you.
Thank you, Senator Stone.
Thank you, Mr. Chair. Ms. Woods, I love your passion, and Senator, I love your passion as well on this. And early intervention certainly can make the difference between somebody living and somebody dying of a cardiovascular accident. And I understand that there's going to be locations for AEDs, and we're going to be training people more for CPR. And we have apps that are either existing today or going to be advanced to accommodate the program. But what is it that is going to designate, what is the official designation for a heart-safe community? Do we know what the criteria will be for that?
Ms. Woods? No, I'm not going to answer
Soraya
this
Woods,
one.
for the record. Soraya Woods, for the record. So interestingly, I was actually thinking about that last night, and my thought process, and I didn't put this and we can maybe include it, is that if we're looking at, let's just say, I'm going to just pick at random, we have like, I don't know, Sun City Anthem, I don't know. And we have maybe 30% of that community, that particular community that is trained. Well, that to me would be a great start to designate that community a heart-safe community, because we have at least 30% of that particular community who is CPR certified through, a recognized organization.
I live in Sun City Anthem area, and I would appreciate you making us a pilot project for this. Thank you.
I love it. Indeed.
Thank you, Senator. Any other questions? Seeing none, let's go ahead and move on to testimony. If you are here to testify in support for this bill, please come forward either in Las Vegas or Carson City. Once again, this is on SB 137 for folks who are in support.
Hello, everybody. Hello, Chair Donyate and members of this committee. My name is Catherine Nielsen, and I'm actually testifying as just a constituent today. I'm part of Senate District 16 and Assembly District 40. A couple of things. So the overall survival rate for out-of-hospital cardiac arrest is about 10%, but this can increase to 40% or higher if bystander CPR is performed right away. So we're talking about a significant increase, and for every minute without CPR, the chance of survival decreases by 7 to 10%. So we are talking about real numbers here. And I've personally had to perform CPR on my husband multiple times. He is thankfully still with us, so I'm grateful for that. However, I know how exhausting providing CPR is and how quickly somebody giving CPR can exhaust themselves. And our state is 87% rural, so we have a hard time reaching people in rural communities, and we're talking about implementing a program that could really truly save some lives here. So I urge you to support this measure. Thank you very much.
Thank you for your comment. Anyone else in Carson City? Anyone in Las Vegas? And AVH, is there anyone in online?
If you'd like to testify in support on SB 137, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chair. It's Dora again. I support this bill, and I ditto what Ms. Catherine Nielsen said, and thank you. Have a good day.
Chair, there are no more callers in support.
Thank you so much. Let's move on to opposition. If there's any opposition to SB 137, please come forward, either in Carson City or Las Vegas. AVH, is there anyone online?
Chair, there are no callers in opposition at this time.
Thank you so much. And last but not least, anyone in neutral testimony here in Carson City or Las Vegas, please come forward. Don't see anyone in Las Vegas or here. AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much. Senator Neal, do you have any closing remarks? All right. Oh, Ms. Woods, did you want to say something? Any closing remarks?
Soraya Woods, for the record. I do just have a few closing remarks that I wrote out. I just want to say that this is a practical, low-cost approach to improving CPR training, accessibility, and AED awareness. It aligns with American Heart Association's priorities, and it would be pretty simple to begin to implement, and I just wanted to stress that fact. Thank you so much for this opportunity.
Thank you so much. And it sounds like you might have a senator that would volunteer for his community to be the pilot program. So we encourage your participation. We'll go ahead and close the hearing on SB 137, and we'll move on to the last agenda item, which is public comment. So anyone that would like to provide public comment, we ask for folks to come forward. And just a reminder, it's for 2 minutes. So is there anyone here in Carson City? Anyone in Las Vegas? And AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to participate at this time.
Thank you so much. Members, are there any comments before we adjourn? I just want to say I'm thankful that we closed it before an hour. We won't get the chance to say that later on. So that concludes our meeting for today. I do want to give just a clear guidance. There's a potential storm that may be coming on Thursday, so we canceled our meeting for that. So the bills that we had scheduled will roll over for next Tuesday. So we'll see folks on Tuesday. And for that, our meeting is now adjourned. Thank you.